Good evening, Facebook, and welcome to another edition of our Facebook Live sessions with MST. My name is Fred Bertino, and I'm so happy to be here with you today to discuss some of the strategies and thought organization processes of approaching USMLE Step 1. This is obviously a really stressful time in a lot of people's life, especially coming to the end of your second year of medical school. And it's time now where you can sort of prove on paper, or at least in a computer-based format, how much of that basic science you've learned in the first 2 years. There are a lot of you out there in the audience today who are at various stages in your preparation for Step 1. You've got your pre-contemplators. These are some of you who have not really thought about the exam all that much, and you're trying to maybe consider building up the motivation to even look into it. And that's okay. You've got the contemplators, and these are people who are actively thinking about the exam and what to do during their dedicated study period. The soldiers in the trenches, these are some of you who may be in the midst of studying right now, trying to somehow get all of this information into your mind. The light at the end of the tunnelers, these are some of you who are just approaching the end point of your study period, almost ready to take that test. And finally, you've got your Olympic divers. These are some of you who are, to say the least, ready to take the plunge into the exam within maybe the next 24 to 48 hours. This live session is going to be for all of you, no matter where you are in your preparation process. So I'm really excited to talk to you about various strategies and how to get the most out of your dedicated Step 1 prep before jumping into the exam. So with the exam, it's 280 questions split over 7 one-hour blocks. You're not usually exceeding 45 questions per block. You're going to have 45 minutes of break time throughout the day, and that could be increased to an hour with an additional 15 minutes if you decide to skip the tutorial at the beginning of your exam. I recommend going through the tutorial in the beginning. You probably already know how to use the software, but it is a good idea just to make sure that your headphones are working for some of the audio-based questions. And once you get past that threshold, it shouldn't take you more than maybe 3 minutes to get there. You can go on with the exam and still take up most of your break time. The idea now is when you're going into studying, depending upon where you are, especially for your pre-contemplators, my advice to some of you who haven't exactly thought about getting ready for the exam, you should start probably thinking about the exam now. Get your mind together, think about what you want to use and what you want to get ready to use. And for those of you who are beginning to contemplate the exam and what your strategy is going to be, you want to start thinking about resources that are going to help you ace this thing. There are a lot of ways to skin a cat in this Step 1 game. Starting with your resources, the tried and true method over the course of many generations of step takers has usually been first aid and UWorld. You can go to any website, and almost everybody who's going to write a review about it is going to say these are the two major pillars that have stood or helped medical students stand upon and get the scores that they've needed. All the other resources that are out there, whether it's videos, flashcard decks, other textbooks, realize that a lot of these are just derivative of these two main pillars of preparation, and that all the information that you would have to know for Step 1 is not only going to be in UWorld and First Aid, but anything that came after that will also cover it in a great deal of detail and hopefully help you to understand those concepts and details as you move forward. The real question that the contemplators have to ask themselves now, those of you who are thinking about what you're going to do for your dedicated study period, you have to ask yourself, how do I learn? And you want to take an effort to learn how you learn. Figure out a way that has worked for you in the first 2 years of medical school and continue on that pattern of success that you've experienced. If you are somebody who benefits from audiovisual learning, then maybe a video series is going to be the way that you do it best rather than just reading a textbook. There are some flexible ways of learning there, but you have to be true to yourself in what is best for you, not what's best for your friends or your colleagues. As a tutor, that's something that I often see very frequently. And there's I guess a fear of missing out, or a FOMO, when it comes to resources. When you hear some of your friends say, oh, I'm using this versus this, and you're trying to sort of organize your thoughts about what the best thing to choose is. Pick the resources that have benefited you in the past in the learning style that facilitates your ability to get as much information in your mind as possible. That's my ultimate advice. That said, as I said before, generations of medical students have done remarkably well with just using first aid and UWorld School of Thought. And if that is something that you feel would benefit you, then I definitely encourage people to use those, because you know that all the questions are essentially going to come from somewhere in those pages and those questions. UWorld, a little bit more on that topic, is certainly a must-have for anybody preparing for this exam. There are a lot of question banks out there, but UWorld has truly been the tried and true QBank that really serves as a nice level of assessment, but also really hammers in those important concepts and details, I would argue better than a lot of other ones. People, no matter what resources you end up choosing, the common denominator between everybody who winds up taking this test tends to be that they've all used UWorld to consolidate their thinking and go along with their question curriculum. I very much advocate something like this, and I think everybody at MST would be behind me when we say that, because it's just tried and true. It's been around for the longest, and you know that it's got all the high yield important factors in there. I remember when I was studying for the exam, a friend of mine and I were talking about it. We were studying at the same time, and we were laughing because UWorld might throw this question up there that seems to ask a ridiculously specific detail. And we're thinking, you've got to be kidding me. There's no way they would ask this on the exam. But sure enough, when we would go back to the chapter in first aid of all places and look it up, that detail would be there somewhere in the text. And it would just reinforce how high yield those QBanks actually are, because they really do go along with what first aid has to offer. Now, when you are more in the middle of your study period, these are the soldiers in the trenches and the tunnelers just looking at the light at the very end, you really want to reflect upon what kind of information you've learned. You're beyond worrying about what resources you've used. Whatever you've done so far, you've used ideally to the best of your abilities, and you've gotten knowledge that has helped you increasingly score well on whatever assessments you've been taking. We'll talk about that a little bit later, but at this point, if you're in the midpoint or the end of your studying, you really want to ask, did I learn what I was supposed to learn? How can you reinforce that? Well, there's a lot of different ways. You can go back and start rereading material, or if you're using flashcard decks, really go back and hash that material again. If you are thinking about what it is that you've learned, or you can't necessarily remember a particular topic, go back to that specific one, even if it's not quite on topic with what you're covering that day, and hash out that material again. For me, getting the viral genomes down is something that's incredibly high yield for the exam, knowing what sort of genomic information each virus has and how that translates into some sort of test question, whether it's single-stranded or double-stranded RNA versus DNA. You have to know that information, but for me, I couldn't get it through my head. So what I used to do is that even if I was studying something like endocrine or cardiology or something totally off topic, I would force myself at various break points of the day to say, Fred, you are not allowed to go on to the next page until you write down every single virus and every single genome associated with it. And if I wasn't able to do that in myself, I would take 20 seconds to go back to that page in first aid and review that information until it became almost second nature to me. And you do this over the course of the day and over the weeks, and as you see what's happening further on, it becomes easier and easier to sort of recite and regurgitate that information that before seemed just sort of like memorizing an arbitrary list. So that kind of information, especially that little detail stuff, biochem, pharmacology, microbiology, it helps to sort of write things down, draw little diagrams for yourself at scaled intervals of times to really build a good foundation in your mind for some of that harder to understand material. This doesn't have to just be with detailed information, though. You can go back and look at old UWorld questions if there's a particular topic that you're not quite comfortable with yet, and it is definitely in your advantage to go back and really focus on those weakness areas. One of the program directors at the hospital that I was doing my internal medicine rotation was very, very adamant in saying, I tell my residents all the time, if you are scoring a 70% in cardiology and a 30% in endocrine, put down the textbooks on the heart and open up the endocrine textbooks, because that's the stuff that has the potential to improve tremendously. It's really hard to take a 70% and move it to a 90%, because now you're getting into the nitty-gritty details of something that might be difficult to remember. But if you're missing the majority of the information in another topic like endocrine, it's way easier to go up that percentage to bring them all at an even 70% across the board. And if you're scoring somewhere in like the 70s to 80% across every particular subject that could be potentially asked on step one, you're going to find yourself in a very above average pool of test takers. So that's something that can be very reassuring. definitely hold yourself accountable to what you don't know. That might be some of my more powerful advice to any of you going through any STEP exam, is know what you don't know and really focus on that information and hold yourself accountable for that information. Now, this is a Facebook Live Q&A, so I definitely don't want to restrict all of what I'm saying today to just me sort of blabbering on about this stuff. If you do have questions that you want to direct toward me, please ask them in the comments, and we are able to sort of I'll be able to take them one by one and see what we can do and make this more of a discussion. I do have one here. How much time should we dedicate to just recalling the learned material? Excellent question. This is something that doesn't necessarily need to take your whole day. This is, think of it as a small quiz to sort of break your thought pattern from what you're currently doing, taking a very small amount of time to go back and really reinforce something, and then go back to what you initially had planned that day. I'm talking about maybe 20 seconds to 60 seconds at most for these mini quizzes, mini mind games that you can play with yourself. We know that if you just sit down in front of a book and read the same sentence over and over and over again, you're going to lose attention really, really quickly, and it's probably not going to stick. But if you break up these mind games with the material that you're intending to learn that day, you'll find that you'll go back to it with more energy every repeated time, and you'll find that more and more of it sticks with every repetition that you see with it. So definitely don't, belabor the viral genomes in any particular set time for the day, but take 20 seconds, try to write them all out. If you fail horribly, take another 20 seconds to a minute to go back to that page, write them out by copying them, cover them up, say them to yourselves, and at the end of the day, maybe 3 minutes have passed, but you've made more of an effort in those 3 minutes to go back over that learned material again to really keep it in the forefront of your mind. That might be my ultimate recommendation for that. It's definitely worked for me, and I found that it's worked very well for a lot of the students that I've taught over the years. Again, if there are any other questions from the audience out there, please feel free to write them in the comments. Judgment-free zone. I'm going to answer as many as I possibly can in our time here. But if there's nothing here, I'm going to continue with some other topics that I thought might be more appropriate. So we talked about how you're going through material. Repetition definitely builds retention. And this is really the fundamental learning theory that flashcards are based upon. When you're using resources that are made by, say, Anki or Osmosis or really anything, and you know that there are tons of step cards for these kinds of platforms, these are spaced repetition guidelines that are trying to give them back to you in intervals of time to help you remember them as best as you can. You can do this with first aid as well if you don't like flashcards, and that's perfectly fine as well. First aid, if you've ever opened the book and looked at how it's set up, it's really like a syllabus with all the high-yield facts in it, but it's really hard to get it to come to any sort of full-sentence conclusion about a lot of important aspects. This means that it's sort of built up like a flashcard in itself. And with your hands or a piece of paper, you can cover up areas of first aid and really quiz yourself to fill in those blanks. I say this to my students all the time. If you prepare for step one as if it's a recall test rather than a repetition test, and what that, or a recognition test, and what that means is if I think that's step one and I'm going to prepare for it like it's a fill in the blank type of test rather than multiple choice question, you're over preparing for it and you're guaranteeing yourself more knowledge and the higher score potential. If you're really practicing to cover up that first aid page and say, what did I just read? Tell myself everything that I learned about Graves' disease. And you're able to get all those high yield points that first aid has to give you by memory alone without any prompt, you know the material. So really force yourself to learn it as sort of a second language, be able to be fluent with first aid, and you know that you're on the right path to getting the material in your mind. Now we move on to the other pillar, the other major one that people use, which I think is probably the most important one. What about UWorld? How do you use it effectively? Well, there's a lot of different schools of thought about this, and probably one of the most common questions I get is it an assessment tool or is it something more than that? And my answer is that it's definitely something more than that. I would argue that it's the textbook that is your step one, that is for your step one course. If UWorld is the textbook, then we said first aid is the syllabus for this course. And when you go through a textbook, you really want to understand the ins and outs of what it's telling you. UWorld is perfect for teaching you how classic disease presents. You know the classic picture of what gout is going to be from a UWorld question on gout. There's no surprises there. You know the age of the patient, the demographic, the risk factors, what their pain pattern is like, what they look like on physical exam, what their laboratory values might look like, what the x-ray findings could potentially be, everything from that one vignette. So if you're just looking at the vignette as a attempt to get an answer, you're not using the potential of what that vignette could give you when you're going through a UWorld question to the fullest. What you really should be thinking about is, what is a typical patient with gout? If you're not able to tell that to me fluently right now, then pay more attention to those question stems, because that really teaches you how classic disease presents 100% of the time. And when you actually take your exam and you've become open to that thinking, you're going to find that on the actual test, you might realize that some of these things are just repeating themselves. And you're going to say, oh, I know exactly what this is because I've seen questions like this before. When you go to the question now, you've understood the vignette, you know how people present with it. Let's jump down to the answer choices. A lot of you probably already know this, but when you look at an answer choice series in a UWorld question or an NBME question, one thing really sticks out, and that's all the answer choices tend to be synonyms of diseases or symptoms you already know really well. They're just saying it in a slightly different version. Take the time to translate that answer choice into what they're actually going toward and use that to help answer your question. If the answer choice that you approach is something along the lines of, let's say, abnormal red blood cell morphology when subject to low oxygen tension, that's basically synonymous with sickle cell anemia. And that's something that you can use in your mind to say, oh, well, every time I see something that looks like this, morphology associated with hypoxia as a stressor, I know that I can now talk about sickle cell anemia a lot more fluently with relation to my question. Finally, the most important thing that when it comes to studying UWorld questions is flipping the question around. Students who tend to do this wind up doing way better than other people on the exam because they're actually looking at the question from a three-dimensional point of view. What I mean by this is, look at the answer choices and ask yourself this: what would the question stem have to say to make any of the answer choices there be correct? If you're flipping that around and you're thinking to yourself, okay, clearly this one was an answer about sickle cell anemia, but this other answer choice was talking about G6PD deficiency. What would the question stem have to change to for G6PD to be correct? And if you're thinking in terms of that, now you're really going inside of the question and giving yourself all possible outcomes of a various topic on step one. The answer explanations at the bottom of it are a great way to check your work with this, because you know the answer explanations are going to tell you what would have to change in the vignette for it to be correct, and the fact that it doesn't mention something or whatever. People who actively think in this way and proactively approach questions this way tend to do better on the exam than people who do not. So just be cognizant of that. A common theme of what I've been talking about here is a very active participation level that is required of you, the learner, in this study process. Passive learners have a hard time getting into this, so definitely remember to be engaged, be optimistic about your exam, and really dive headfirst into this information, because with that right attitude, you're going to actively tackle this head on and learn things a lot better. Okay? Now, going back to even the title of our Q&A, what can you do to prove that you know something well before going into the exam? You feel like you know everything, but how can you prove it to yourself? Well, it all comes into tracking progress over time. If you see a trajectory of increasing scores, oh, I see Emma saying active learning is key. I agree with you, Emma, 100%. Active learning is so important to this process. If you see a trajectory of score increase over time, you know that you're doing something right. So that should be reassuring and confidence building for you, okay? Realize that a single score means nothing. If you take one NBME and you bomb it and it's horrible, but you've taken the time to actually do the other ones really well, maybe that's just an outlier. It's not predictive of anything. That said, what is predictive of our scores on the exam? I'm going to be honest with you. There's not really one great thing that does that. People will say that NBME exams are truly a predictor, or UWorld is truly a predictor of a score on the step one. I would have to say I disagree with that logic. The reason being is because it's just one point in time, one exam point in time, and that never really correlates with anything. You wouldn't trust a scientific study or give a patient a drug with a sample size of one patient who happened to maybe make it work, right? So why would you do that for yourself on the exam? You need multiple data points. You need multiple exams to basically give you an idea of how you're going to do. What I've tended to see when it comes to NBME exams and score prediction, quote unquote, is that people can expect to score anywhere within plus or minus 15 points, okay, of a score on their final exam. That's a spread of 30 points per one exam. That's not very reliable. It's not a very reliable indicator. That's the difference between a 230 and a 200 if you get a 215 on your NBME practice exam. Not a very reliable indicator of performance. So what I tend to say is take multiple exams, maybe around the same time period. Some people like to save up a good handful, maybe 3 or 4 exams of NBME exams to the end of their study period. And in the course of a week, maybe take them one with like skipping a day in between. So one, skip a day, take another one, skip a day, take another one. And at the end of those 4 exams, if you really wanted to see how you were doing, you might want to average those scores together and see what that yields. If it's something around your goal, then you should be ready to go in and take your test. But if it's something below passing, don't think that on exam day, you're going to get that magic swish on the upper side of that 15-point swing to your advantage. It helps you be honest with yourself, and it helps you understand the trajectory that you've taken to learning the material. So be an active learner, but also be an honest learner with yourself. If something is not working for you in your exam process, do not be afraid to say, no, I'm not going to continue with this, and try to change it up. It would be to your advantage to do that and detriment to not do that. So keep that in mind. Moving forward, the last piece of advice here, at least for some sort of my points that I wanted to talk about, is for the Olympic divers in the group. Those of you who are just about to get ready to take the plunge into the exam. What are you going to do? Well, be confident. You've done everything you could to this point. And if you're true to yourself, an active learner, and really put your best foot forward, you've definitely done everything you could have done to ace this test. So be proud of that and be ready to go in and really conquer this thing, okay? You want to manage anxiety. That's the hugest part of this exam. You know, going in there, I've seen people go in, they've known this stuff better than anybody, and I've attested to that. But when it comes to the actual game time, they may fall apart. Take a deep breath. Realize that this exam is arguably the fairest exam you've ever taken. There are no trick questions on this exam. Everything in the question that's given to you is something you have to know for it. If you ask yourself, but what if this, or suppose this in the STEM, you're going down the wrong path. Just stick with what the question is telling you and come up with the most likely answer based on that. It truly is that simple. And you know this because that's how UWorld and the NBME exams are formulated. So trust the process. You've done it the right way. Keep going on that path and don't second guess yourself. You know it better than you think you do. When it comes to the exam process, sometimes the head might fail, but the gut down below is actually the part that knows better than the brain. So trust the instinct. If you feel like the answer is B, but you don't know why the answer is B, the answer is probably B. Don't stress about it. Go with your instinct because something you learned at some point in the past is telling you that that's the right answer. You don't know why you know it, but just go with it. Okay? Don't change your answer on the exam unless you have a legitimate reason to do so. In my mind, the only legitimate reason to change an answer on the exam is when you say, I meant to click C, but I accidentally clicked B. Or, wow, I read that question totally wrong. It's actually C, definitely not B, so I'm changing my answer. Those are the only 2 scenarios in which you should change your answer. If you're changing it based on a guess, you're likely to get it wrong. Why? Because your instinct told you to pick something first. Go with that instinct. You don't have a better reason to pick another answer. Stick with your gut. You've got a lot of time during that day. It's an 8-hour day, 7 blocks, 60 minutes per block, with about an hour, 45 minutes to an hour of break in between. How do you break up that time? That's up to you. Personally, when I went in there, your adrenaline's pumping in that first part of the morning. You're ready to go. You've got a lot of energy. You're psyched up. What I decided to do was take the first 2 blocks almost straight through. First block, stretch a little bit in my seat for 10 seconds and go right into block number 2 because I knew I had the energy for it. Between 2 and 3, I was like, okay, we've already been doing this for 2 hours. Stand up, leave the room, take a little bit of a walk, come back in, and then I just busted through block 3 and block 4, similar to how I did 1 and 2. Block 3, take a 10-minute stretch break in my seat, go right into block 4, and the next thing I knew, I was more than halfway done with the test. At that point, I took a nice, leisurely 20-minute lunch to myself. I walked up and down the halls, I stretched out, I got used to it, and I went back in knowing that I was over the hill. I only had 3 more blocks left in the exam. You're obviously a little bit more tired now, and your adrenaline is probably decreasing a little bit as you approach that latter end of the day. So I decided, you know what, this is not the time to rush anything. This is just the time to take your time, appreciate why you're here, and do the best effort you can. How did I do that? I took a break after each block as I concluded the day. So block number 5, took a 5-minute break. Block number 6, took a 5-minute break. Block number 7, finished with the test. And it worked out really well. Pace yourself, know what your limits are, and go appropriately forward from there. On the day of the exam, there might be habits that you probably know are bad for you, but you really want to try to stop them. The day of your step 1 exam is not the day to quit drinking coffee. Or if you've never drank coffee before, it is not the day to start drinking coffee. Your step 1 exam day should be the day just like any other day of doing UWorld. Mimic it exactly how your study practices were, because that's really what it's going to feel like. Just another day of long-term studying, okay? Don't experiment with anything on that day. That's huge advice, because the last thing you want to do is have like gastrointestinal upset in the middle of block 4 and you don't know what to do. So that's, you know, not a personal story. It didn't happen to me or anything like that, but, you know, asking for a friend kind of stuff. I see some other questions here. Do I have any recommendations for what to do the night before or the morning of the test? Yeah, we sort of briefly touched on that, but that sort of that's a great question. So night before the exam, you know, you're going to want to go back into first aid and UWorld and go through so many topics over and over again to try to get things back in. And you know, a lot of people will agree or disagree with the notion of, you know, is there something to be said for short-term memory? When I was in high school, we had a teacher who used to say, he would see us all studying for finals in the homeroom, and he would say, if you don't know it by now, you don't know it at all. So just put the book away and, and you're done. And it didn't take me until maybe medical school that I realized he was totally right. The benefit you might get from doing that on the day or the night of before you go in is maybe remember 1 or 2 more facts if they show up on the exam. But in reality, the things that are really going to come back to the forefront of your mind are the stuff you've learned over the long term. So definitely don't give up on that ability to learn over the long term. That's the stuff that's going to have to stick with you. So the night before the exam, I just recommend getting a good night's sleep, doing something to help you unwind, if it's watching a little TV show or just hanging out with family or something to de-stress. Just do something enjoyable to you and revel in the confidence that everything you've done to this point has been worthwhile and definitely beneficial to your success on this exam. If you don't study for those last 3 hours of your final day of studying on the exam, it is not going to be the difference between a 250 and a 180. It's not. It really isn't. You're going to score what you're going to score, and it's going to be very, very close to whatever you've been doing. It's that trajectory we were talking about. So don't switch it up at the last minute. Have confidence in yourself the night before, and don't go crazy into the book. I remember when I was taking the exam, so funny story with me, I was ready to take the exam on a Friday. I went in, there were technical difficulties with the exam, and it totally threw me off my game because they said I had to come back at a later time and take it on Monday. You could imagine how furious I was. I've been preparing for this thing for 6 to 8 weeks or something like that. I come back into the exam, they tell me I have to go home, wait a whole weekend before I can come in on Monday morning and take it at a new schedule time. I was furious. What did I do during that weekend? Nothing. I sat down on Saturday morning, the day after I took Friday off because I was furious. Saturday morning, I sat down in front of first aid and I said, you know what? I can't focus on this. I cannot read anymore. I'm so burned out from studying. So over that weekend, I had lunch with my family. I went out. I I had fun. I didn't go crazy partying or anything. I had an exam on Monday, but I did enjoyable things. I watched TV, I unwound, I calmed myself down, and I went out on Monday morning and I took the exam, and the exam result was fine. 254. It's fine. Night before, day before, doesn't matter. What's better is to get your mind calmed down and confident that you know everything you're supposed to know. Do we have any other questions that are out there in cyberspace, or anything that I can clarify? We're coming a little bit to the end of our time here. A couple of other questions that popped up here. How many passes do you make through UWorld? If you talk to the majority of people, they're going to advocate twice. How realistic is that? That's really tough to do if you don't have the time. What I have found most people wind up doing is usually 1.5 times. You should definitely get through it once. The second time, based upon how many runs or how much time you have left, should really be based upon that, and focus on the areas that you don't know. So focus on the incorrect answers, or the ones you flagged or something, if you're going to look at UWorld again. I see here, if I've completed my first pass through UWorld, should I supplement it with a different QBank? My recommendation on that is actually no. I would rather you learn one resource extremely well than to try to diversify you know, the QBank and the question thought. The exception to that might be if you've been through UWorld like 2 or 3 times, maybe you've done it once before, you've extracted everything you possibly could have out of it, and you know UWorld like the back of your hand, then yeah, if you've mastered it and you're very capable of getting 100% on every single UWorld question, then maybe you can jump to another bank and hear a different point of view. But I don't want a different QBank to shake up your confidence, because realize they might write questions a different way. So take it with a grain of salt, but I definitely put an emphasis on using UWorld to the highest of its ability before you start looking for other question resources. I see another question here. If I'm just about to take my first NBME, should I take a specific one? Are there any recommendations there? Excellent question. The NBMEs are NBMEs. The material hasn't changed. Maybe a couple of updates when it comes to basic science research have maybe made their way into first aid, but it's going to take a long time for the exam to really mirror those changes before you see any dramatic changes in how medicine is working on step 1. So my advice to that is no, it really doesn't matter which one you take first. They all essentially are around the same assessment scale. Take them with confidence, learn from your mistakes, learn from your weaknesses, and just move on to the next one. I took them randomly. I just picked them at random and went for it. Some people prefer to take the most recent exam last because they feel like it's the most relevant or appropriate toward the exam they're about to take. That's fine with me. It doesn't matter. It truly doesn't matter. So as long as you're using them as a benefit and a stepping stool to getting a higher score and augmenting your studying, to me, that's far more important than what order you take them in. I want to thank everybody for your time today. I really hope this was helpful. If you guys have any questions about anything, maybe I couldn't get to it today, or maybe you were too shy to ask, that's fine. You can always get in touch with us. You can email us at hq@medschooltutors.com, or you can call our office directly at 212-327-0098. People there are so nice. They're so ready to help you, and they're willing to hear what's on your mind, what they can do to help you out, even if it's just a vent session, or maybe you want to work with us. That's fine too. But see what we can do to help you out. We're happy to be here. And with that, I'll say good night.